Good evening. For the first time since the start of the pandemic, nearly 2 years ago, the UK has recorded more than 100,000 new cases of coronavirus in a 24-hour period. Despite that high figure, the latest evidence from several studies suggests that fewer people are going to hospital with the new variant Omicron. But experts say they need more evidence before they can be certain. Now, during the day, the Health Secretary, Sajid Javid, announced that the quarantine period in England for people who test positive is to be cut from 10 to 7 days, and that is from today. The condition is that people will need 2 negative test results on day 6 and day 7, and that those tests must be taken 24 hours apart. And it's hoped that this will give more flexibility over the Christmas period, as well as easing pressure on the economy, with staffing levels badly affected in so many areas. Our medical editor, Fergus Walsh, has the latest.
Another record day for COVID cases and for booster jabs. But as the Omicron wave surges, at last some positive early evidence from 3 separate studies, all indicating it poses less of a threat than the Delta variant. Research by Imperial College London found around a 40% reduction in the risk of being admitted to hospital for a night or more compared to Delta. A Scottish study suggested there was a 65% lower risk of being hospitalised with Omicron, but it was based on only a few cases. While in South Africa, Omicron patients were thought to be around 75% less likely to need hospital treatment. Rather than Omicron being intrinsically milder, scientists think this is partly due to the build-up of immunity from previous infections and vaccination. But it is still good news.
These are very encouraging signs indeed, and it does mean that the models that have been presented to us and presented to the government, which have largely been based on assuming rather pessimistically that Omicron was of the same severity as Delta, I'm sure are being revised very rapidly at the moment.
The festive getaway has begun, and there was an early Christmas present for many who thought they'd be isolating on the 25th. After the rules in England cut the quarantine period from 10 to 7 days. Lee is already anticipating heading home. His lateral flow on day 6 was negative this morning. If tomorrow's is clear, he's free.
Well, it saved Christmas for me. I thought I was kind of here till midnight on Boxing Day in self-isolation, so I can go back to the family home now and see my young daughter.
People ending isolation early are urged to be cautious and not visit crowded or poorly ventilated places, because even after a week, it's still possible to be carrying the virus and it not show up on lateral flow tests. More than 51 million people aged over 12 in the UK have had at least one COVID vaccine, nearly 31 million 3 doses. Now, all 16 and 17-year-olds will be eligible for a booster, and those in line for first jabs is to get even younger. In the United States and several European countries, all 5 to 11-year-olds are being offered COVID jabs. In Texas, these therapy dogs provided a useful distraction. Here, only 5 to 11s in at-risk groups will be eligible for now. They'll get 2 shots 8 weeks apart, each one a third of the adult dose.
We know these vaccines are effective at preventing serious disease. That's the one thing that they do reliably. And so it makes absolute sense that we offer those children that are at high risk the benefit of protection from vaccination now that the vaccine is available for the age group.
New treatments continue to be rolled out, such as antiviral pills like molnupiravir, which should keep many of the most vulnerable from falling seriously ill once infected. The concern is the huge number of cases, even if mostly milder, could still lead to a dangerous spike in hospital admissions next month. So the scale of the Omicron threat remains uncertain. Fergus Walsh, BBC News.